afternoon. I hope everyone is well. And thanks so much, Angie, for leading us in that grounding and steadying practice. I think it's a great reminder for us as well as we bring that sense of steadiness into the rest of the time that we have today. I would also like to remind everyone to just as we are going through maybe sometimes a little bit of a heavy topic at points, just notice any judgmental or critical thoughts that you might be having and try to maybe have an intention to bring a bit of friendliness, a bit of kindness to ourselves. I think that's extremely important, even as we are talking about things that, and I'm sure all of you are here also because we deeply care about the issue and we deeply care about the people close to us. So we are here to really understand a little bit more, okay? So just keep that in mind as we go through our time today. So I want to really start by really talking a bit about what actually we mean by when we say mental health. You know, if you are following popular discourse online, you know, in social media, people are throwing around the term mental health a lot these days. Everyone wants to talk about it. It's really a hot topic, you know, and people are all about, you know, increasing awareness about mental health. But when we say mental health, what do we really mean? And mental health is essentially the aspect of our health, overall health, that encompasses our emotional, psychological, and social well-being. So generally, a few domains, our feelings, the way we think, as well as how we relate with other people. And so when we talk about three domains like that, then essentially our mental health actually is has a huge impact actually on the way that we live. And it affects the way we feel, think, and act. It affects the way we handle stress. It affects to a large part, the way we relate with other people, the way we are in relationship with other people, and also how we make choices. We're making choices constantly, even though most times we are kind of on autopilot and not conscious about the choices we are making. So subconsciously, our mental health is actually nudging us in certain directions when we make choices about how we, you know, feel, think, and act around other people. So it's something that really is very deep-seated and important. And I want to remind people that one bit that often is missing from a lot of popular kind of discussions about mental health is actually mental health does exist on a spectrum. So it's a range. It's not either you are healthy or you're not healthy. It's not so much that you either have a condition or you don't have a condition. So I think sometimes we get caught up in some quite kind of black and white thinking in that way, but actually our mental health exists on a spectrum, on a range. And we often are only paying attention to people at the bottom end of the spectrum, where people may be having symptoms that are severe enough to qualify as a mental disorder. And then we say that people should seek help, professional help, see someone, you know, be on treatment and things like that. But actually, for people who don't have a mental disorder, they may or may not be actually doing that well themselves. So there is a segment of the population who may be what we call languishing. So that's a new term that we're starting to realize, that there are people who are not quite ill. They wouldn't meet criteria. They may be functioning still fairly well, but they're not doing that well either. I mean, they may have some mild symptoms, or they may just be on the edge of, you know, tipping over into illness. And then, of course, a majority of us would be actually in the well stage. But what we really want to aim for is that we want people to be thriving. We want people to be flourishing. So at the top of the range, we have people who are, you know, so well adjusted, and they have the full range of emotional skills to be able to deal with the difficulties of life, to problem solve as problems come, you know, and they can meet challenges and grow from them. That's what we mean by flourishing. So these are people who are really thriving. So the goal of actually mental health work, a lot of times, even though I'm a psychiatrist in a hospital and my work actually deals with the bottom end of of the spectrum. I treat mental illness as in the course of my work, but actually, you know, there is a lot of room for more work and effort, and which is what Brahm Centre has been doing a lot of, and it's a personal interest of mine as well, is really moving people upwards along this spectrum, away from illness, that's treatment, but also for people who may be languishing or people who may just be well, how do we move them more into the stages of flourishing? So that's a big question that, you know, I hope that we can kind of keep in our minds. It's not just about treatment of disorders. So when we talk about mental health, and this is especially important when we do our assessment, actually, when if a patient or client ends up seeking help, when we look at mental health, a simple way of actually breaking things down is to look at mental health in 3 components. That is biological, psychological, and social. So what I mean when I use these terms, essentially biology is what makes us up in our own bodies, okay? And very commonly in mental health, we refer mostly to the brain. And the brain is essentially made up of chemicals as well as circuits. So brain chemicals help brain cells talk to one another, and brain cells connected to each other actually form circuits, and they determine a lot about how we think, feel, and behave. But biological elements of mental health is not just limited to the brain, actually. The rest of the body actually plays a very significant part. Things like our gender, there are influences as well. The state of our physical health is a major one that has close interlinks with our mental health. You know, the state of our gut health, how healthy our digestive system is, we are realizing has a huge impact as well. Whether we are struggling with disability, and also our genetic makeup. You know, things like family history, also has an impact on some conditions in mental health. So these are the biological aspects of things. In terms of psychological aspects, what we refer to psychologically is essentially my thoughts and my feelings about the world around me. So that's what goes on in the head, the thoughts and feelings. It encompasses the subcategories of personality. We all have our own personalities. We all have personality traits, some good, some not so good. It encompasses the kind of values and attitudes and beliefs that we actually hold and we carry with us through life. Psychological aspect also encompasses our ability to learn, our learning ability, as well as our memory function. It encompasses the social skills that we pick up over the course of our development, and also our idea of who we are as people, ourselves, our self-identity, our level of self-esteem, self-acceptance, and self-confidence. And the last element is equally as important. The social aspect of mental health is how essentially refers to the circumstances around you, your environment, and how it's affecting you. And that refers to things like family, the education you receive, the amount of social support and the social network that you have. For example, the friendships that you are maintaining. Work is a big part of our lives. Work forms a big part of our identity. So how well our work life is going is a big determinant of mental health as well. And actually also our socioeconomic status, because that unfortunately or fortunately really determines the kind of resources that we have at our disposal. So that does play a part in terms of our mental health as well. So it's a lot to go through, but essentially, I think what I would like to what to convey to you is that we call this the biopsychosocial model of mental health. And it's a simple way of for us to understand mental health by breaking it down actually into these 3 major categories. And the thing to understand is that all 3 components actually exist within each person. There's no one person that doesn't have or is missing one component. And actually, they all kind of overlap and influence each other in complex ways. So that's essentially the process that we go through. We actually are assessing or analyzing each person in each domain. and looking at, okay, what are the factors that are playing a big part in this person's mental health problems. So today we are here essentially to talk more about and understand youth mental health. Now, what actually is so unique about youth mental health? The truth is actually youth struggle a lot with the same conditions, same mental health conditions as adults do. But actually there are unique as elements of youth and the stage of life that they are going through that deserves really us paying a little bit more attention to. And we will see the impact of this later, what's the outcome of it. But essentially adolescents or young adults, this period is a period of significant biological, psychological, and social changes that youth need to adapt to. Okay, so they're undergoing a period of transition, and they're grappling with a lot of changes that they need to adapt. And changes are always stressful, right? That's why, this is a vulnerable period. So all these physical and brain changes actually have a big role to play. And we'll see in more detail how this happens. So many of you may already know that actually our brain doesn't mature. We often take the ages of 18 or 21 to be the threshold of adulthood, but actually the brain doesn't actually mature fully until our mid to late 20s. We used to think that 25 was kind of the age where the brain kind of matures, and then unfortunately it's downhill from there, right? But actually we're realizing that the brain could take even longer, up to the 30 to kind of mature. And also it's important to know that the brain continues to be the term is plasticity. The brain continues to be molded or be shaped by our experiences even after that. But especially during adolescence or young adulthood, this is a period where there's so much physical, hormonal changes in the body that actually the brain itself is also undergoing huge amounts of reorganization. A lot of how in childhood, actually the brain is busy really filling out, the brain cells are multiplying, they're growing, they're connecting. But adolescent period is when these brain circuits and connections are being pruned, which means that the experiences that children actually are having during adolescence are having a big impact on which brain circuits remain and which brain circuits are deemed, okay, I don't need this for adulthood and should be, reduced. So it's a huge period of brain imprinting, essentially. And all these changes actually make it very susceptible to environmental influences. So what's going on around us actually has a deep impact on actually what's going on in our brain. And like I mentioned, right, during puberty, with all the hormonal changes, the physical changes that's going on in the body, is also leading to kind of gender-specific restructuring influences on the brain. And what's going on actually is that as the brain is maturing, I think studies have shown that there are areas of the brain that mature earlier and areas of the brain that mature later. So unfortunately, human beings, we kind of see we are at the kind of apex of the food chain, right? We're the top predator, but we are not spared from evolution as well. So our brain actually is made up of different components, and there are more primitive components, which are components that deal with like our danger signals, the stress in our body, the emotions of memory. These are slightly older parts of the body. And the newer parts of the brain, and the newer parts of the brain, the frontal lobe, is where we deal with planning, with controlling of our behavior, impulse control, we deal with judgment, we deal with execution of tasks. So what we know about brain development is that the more primitive parts of the brain, they mature faster, they may mature earlier, whereas the more advanced parts of the brain mature later. And what this actually translates into is that the parts that govern things like reward seeking, so reward seeking behavior, expression and processing of emotions, aggression, stress and danger signals, social motivations. These are within the more primitive parts of the brain, and we call it the limbic system, and that's what matures first. And the parts that are more to do with impulse and behavior control, planning and judgment, they develop later. So what this means for adolescents is that essentially that there is a very strong biological explanation of why adolescents tend to be more emo, they tend to be more impulsive, they tend to gravitate more towards things that feel rewarding. It's because all these there are really solid biological changes that underpin a lot of these type of behavior traits that we see in adolescents. And so because their rational mind develops later, they seem like they are not thinking through their decisions, they are more impulsive, they don't seem very rational. Yeah, so they are very prone to experiencing more intense emotions, and are also prone to take risk or take impulsive behavior. So don't blame your teenagers, or don't blame young adults, for behaving in a certain way. There's really a biological basis for a lot of this as well. So what we have already covered is as I've explained, all the rapid physical and brain changes that's resulting in this period of vulnerability. But we also know psychologically it's a period of transition. And why is that? It's because the adolescent period or the young adult period, especially in today's age, people are leaving home at a later age. So adolescents and young adults are in this period where they are undergoing what we call kind of a separation from the family. You know how as children, our lives are almost completely consumed by the family setting. We are very attached to the family because the family provides us with shelter, with protection, with food. Our needs are met by the family. But adolescents and young adults are in the stage, I'm venturing beyond the family now. I am navigating this transition into becoming an independent young adult. And the process of independence means I must seek out my own identity. I must seek out and craft my own value system. It may differ from the value system of the family or of the parents. And I'm trying to bridge this idea where I'm seeking independence. I need to be autonomous from the family, but I still need to see how I can remain connected with the world around me. So I'm connected on one hand to family, but I also want to connect with the wider world, my friends and society and beyond. And that's why a lot of this transition actually explains why adolescents seem to be more rebellious. It's a period where they seem to be going against the family. They often, a lot of parents often complain, oh, they seem more close to their friends than closer to the parents now. They rather talk to their friends rather than talk to the parents. Again, it's explainable by a lot of the transition that they are going through, that they are crafting their own identity. And what we understand psychologically, or what a lot of people postulate, is that if adolescents or young adults can navigate this stage successfully, they will be able to gain independence while remaining connected with the family and with the world around them. So it's an important stage that they are going through. So, in summary, all these changes, all these transitions that they're going through actually make this a key development period within which actually a lot of events or problems that occur to them can actually have quite lasting consequences, unfortunately. So what does this all translate into in real terms impact on their mental health, right? How does mental health, the state of their mental health, impact our youth? It really means that how well they are mentally is directly having an impact on their day-to-day experiences. It's directly having an influence on how well they interact with other people. Is affecting how they understand the world around them. For example, if their mental health is dominated by a lot of anxiety or fear, then they will learn that the world around them is actually a dangerous place, and that continues to perpetuate into adulthood. it clearly affects performance and achievements. That's something we, as a very driven and competitive society, we pay a lot of importance to. And also actually it shapes their ability to cope with problems in general. So really all encompassing many aspects of their lives, but also understanding that the interplay between their mental health and the challenges that they are meeting in the environment. And one thing in all my reflections of seeing young people, so generally in my practice, I don't see so much of the adolescents, but I do have a large population of young adults in my practice. So I do see a lot of the influences and that are coming through from their environment. So we already know that, you know, we are particularly competitive, very academic driven society. And so a lot of pressures come actually from school, possibly from parents, even peer-to-peer pressure or self-pressure, pressure coming from themselves, expectations of how well I should do in school, form a large part and a large contributor to the stress that youth experience today. But also there are actually quite unique changes as if we observe how society has changed over the last 10 to 20 years. There are quite major changes in the way that we lead our lives so far. Essentially, if you look at it, media consumption today is really now on demand. In the past, we used to have to check a TV program, if you remember, for those of us before entertainment on demand, we used to check a TV program. There was a timetable. You know, if you miss it, you miss it. You won't get the same program. You may have to wait for a rerun, and that's not within your control. But today, just turn on any device. You have YouTube, you have Spotify, you have, you know, Netflix, and all these platforms are just feeding you so much information. There's so much choice that's out there, and it's kind of driving, I guess, a little bit of a kind of a perspective about instant gratification. It's an idea that if I want something, I must have it immediately, or must come quickly, that kind of thing. So again, very subtle, very nuanced influences on actually how we are thinking, you know, even as a population. Social media is a big aspect of it. And with the advent of social media, I would say in the last 20 or so years, it's really changed the way that we interact with the world around us. In the past, our social circles used to be limited to our family predominantly, and perhaps the social circles among our friends in school. Maybe if you have a faith community, that's a little bit more of a community that you have a social circle there as well. But now we are not limited by physicality in terms of who we relate to. We are not limited by you know, physical limitations of who we are exposed to. So you can see the lifestyles from the super rich to the really needy, you know, all through social media. So all this actually has an impact also on development, because we form our sense of self and our sense of meaning and our understanding of the world through the lens and the exposure that we are actually seeing. So social media is a big one. Technology also has brought so much convenience to our hands, but at the same time also, you know, kind of sometimes it's a double-edged sword. It makes things so convenient that sometimes we don't have to step out. We don't have to put in any effort for things. And for example, one impact of technology is you can lead your life without ever stepping out of your house. You can work completely online. You can find jobs that are completely online. You can order all sorts of things. You can shop online. You can order your groceries. You can, you know, bring in all sorts of things on, you know, through technology at our fingertips now. So it's unfortunately helped people who are becoming more reclusive to really, you know, not to maintain that comfort zone that they are too stuck in. And also, I put in a bit more about economic trends here, because that's one thing that we don't realize that I think our youth are also having to grapple with. The kind of quality of life improvements that perhaps our parents' generation enjoyed over their lifetime. The idea that if I work hard, I'll be able to achieve certain quality of life. These are rules, or these are concepts that actually for youth more and more today are no longer actually holding very true. So, in a lot of advanced economies around Asia, you can look at like Japan, Korea, Hong Kong, a lot of these places, youth are struggling with a deep sense of dissatisfaction, because no matter how hard I work, there will be no way I can own my own home, for example, in many, many societies. And that kind of disparity, income inequality, and what it means to work hard is really changing over time. So you have new movements like, quiet quitting, all these concepts are born out of actually the trends that we are seeing in society today. So the truth is, I think in summary, touching on all this really is to impress upon you that our youth are growing up in very challenging circumstances. Perhaps, and this may be a bit controversial. I think every generation will say that they had their own challenges, but I would hesitate. I would venture to say that life these days is more complex and more challenging than it ever used to be. So I think that's why it's really important for us to bring a lens of that kindness and compassion, especially when we are dealing with people who may be struggling or challenges within family systems, when we are trying to help people. So spend a little bit more time talking about this, because I think this is important for us to realize and understand, or to reflect a little bit more on, especially when we are interacting with or trying to help and support our youth today. We just need to put ourselves in their shoes a little bit more. And what does all this kind of translate into in terms of mental health trends today for youth? And should we be concerned? Now, unfortunately, here I don't have very much good news. So I pulled mostly, actually, I tried to focus a bit more on local data. And we are having some very good studies coming out from NUH, from IMH, about the state of youth mental health. And a very recent one that was reported of a big study done by NUH is that actually 1 in 3 youth report symptoms such as sadness, anxiety, and loneliness. So not to say that 1 in 3 have mental health problems, but 1 in 3 actually experience such symptoms and are of significant level enough to report it. Generally speaking, we are looking at numbers of about 1 in 7 youth have a mental disorder. So we are that works up to about 14 to 15% of youth actually struggle with a mental illness, 1 in 7. Unfortunately, suicide is a leading cause of death among Singaporean youth. So I think that age is up until to age 29. SOS will have the numbers, but it really is a leading cause of death, partly because life in Singapore is very safe, right? So youth are not dying from infectious disease or accidents and crime and things like that. But unfortunately, that makes suicide the top cause. Also, mental illness is actually the largest contributor to years lost to disease. Years lost to disease is this concept we describe in a sense that we want to understand what is the burden of disease among a population. So if let's say comparing a population that was healthy versus a population that is unwell, actually what is the impact of this disease burden? And unfortunately, in the 10 to 34 years age group, mental illness is the largest contributor to burden of disease among Singaporean youth. And unfortunately, what we are seeing across the board, actually this is global, is that there is a very consistent trend of worsening mental health in youth across the world. Partly maybe a little bit also because of increased awareness. So people are more willing to kind of come forward, they're more willing to declare, or the awareness is there to realize that I am struggling with some of these things. So awareness does play a part. But I do we do believe that the trend is genuinely kind of worsening over time. And in last few years, people were tempted to say, it's because of the pandemic, right? I mean, that was a big kind of event that happened to everyone, and it caused a big changes in our lives. But actually, this trend it predates the pandemic. So even before 2019, the trend was already kind of getting worse. So pandemic is not the only contributor. And very unfortunately, also this trend of worsening mental health is also coupled with quite a bit of a shortage of youth mental health professionals within the Singaporean public sector. So child psychiatry, child and adolescent psychiatry is an area of very big need. We are seeing very long waiting times for youth and families who are needing to seek help. And that's why we are still playing catch up in terms of building up the community resources, the skills within the community, not just professionals. I mean, not just doctors. I mean, you don't want to rely completely on psychiatrists to provide this, but the entire community support of social workers, counselors, voluntary organizations, support workers, all these need to be, upskilled, need to be equipped with the training and the knowledge to be able to help our youth. So it's really a community effort. So with shortage of actually the professionals right now, the access to care has been quite limited. So some of you may be already aware of this. So I decided partly that I don't want to spend too much time going into actually mental disorders. I think that one will probably become quite technical. Just to briefly describe to you some of the trends we are seeing, essentially among youth, the top disorder that they are most commonly diagnosed with is actually anxiety. And depression is a close second. Internationally, ADHD is probably one also that is extremely common, but in Singapore, that's not something that is very, that we are not kind of catching up in terms of ADHD rates in that sense yet. So anxiety and depression are big topics. A lot of it is stress induced, or stress is a big contributor to both these conditions. The rest of it, things like psychosis, OCD, all that are lower on the list. But essentially, it's the same way that it's presenting in youth as in adults largely. Yeah. That's pretty much it. So if you were to seek help, then what actually doctors would do is to go through the process of assessment, and then we'll discuss a little bit of treatment with the patient as well as their family. So if you have specific questions about any conditions you would like to know more in detail, I would be happy to answer that in the Q&A segment. But I thought I'd want to rather go on to something a bit more practical, and that's really looking more into what can we do about it. I think as caregivers, as family, or even as youth who are affected, the important thing is that prevention is way better than cure. So rather than waiting till illness or disorder manifests, it's really early recognition of that, that we can do more in terms of equipping youth with the ability to be more resilient and with the skills to meet challenges. That really would be what makes the difference. So I kind of actually in this topic is very broad, and there's so much that I could possibly go through that even an hour would not really be enough, but kind of broken it down into different categories. And so let's take a bit of time to go through that. And I think the top one that I want to talk about in terms is connection. And by connection, it really means human to human connection. And it really starts with the relationships. And where that begins, it has to begin from the home. And I cannot stress this enough, that all mental health and the way we relate to people is so closely intertwined that it really is forms such an important part of mental health awareness. And really, there are two components to relationships at home. One is the in general, the relationships people at home have with each other. So a lot of it comes back down to also the parental and the marital relationship. That is actually a huge foundation. Actually, it forms a foundation of what children actually view, they are seeing, they're observing, and what is modeled to them, and what they are learning from their parents. So being, consistent in terms of your treatment of the child. Are you on the same page? How well are you communicating parent to parent? Is the value system aligned? Yeah, it comes like communication. I cannot stress that enough. If communication breaks down, actually the kids are learning all these bad communication skills, or that they don't learn to communicate well in that sense. But second, so that's family relationships, but the second element is the relationship that the child has with each person in the home, right? Are there good, healthy relationships that form their source of support, that can be a safe foundation from which that they can return to if they are facing challenges or difficulties, and form a solid, stable foundation from which they can explore out of the home, right? Explore other relationships, their friendships, eventually also romantic relationships. It really you need to have a safe base to actually successfully manage a lot of all this. And if you reflect on relationships, what are the essential ingredients? It comes back to safety. It comes back to trust. Comes back to that degree of connection that I have with you. And safety really means that if I come to you with my problems, you're not going to turn around and hurt me, right? And that's one thing that unfortunately we often see in a lot of parental relationships. And that's one thing, even reflecting, if you reflect on personally, you may realize this, that a lot of parents, out of concern, they actually are more critical or more blaming in nature. That's a very common pattern that we see in parents, that if something went wrong and child comes to you, you say, I see you didn't do as I told you, right? Or why didn't you do that? Unfortunately, it's quite an invalidating kind of response. And it also kind of lays the blame and the criticism on the child. So that actually violates the idea of safety. And if I don't feel safe coming to talk to you, sharing with you my emotions, my problems, then I'm going to stop doing that. And a lot of parents wonder why they don't talk to me. But actually, when you look at their response, everything that comes out is your fault. Why didn't you do this? You should have been more careful. Very common. Even as I'm saying this, I'm sure you realize that sometimes we lapse into some of these things. Trust means that, I can trust that you are there for me. If I come to you, you will give me your attention, right? And that you will not hurt me as I do this. And then, of course, connection is also about the degree to which actually you can share my joys, you can share my concerns, and you understand what I'm going through. So unfortunately, with society and our modern lives changing so drastically, so quickly, actually the generational gap is definitely present, because as parents, we may have certain views and values, but our kids have different interests, different, things that give them meaning are completely different from the parental generation. So can parents be a bit more intentional in making that connection? Hey, what gives you joy? What gives you pleasure? Can I share in that? Can I try to participate in it and understand it? And all these elements are so important in building. These are the building blocks actually of the relationship, right? If you can't be bothered to kind of understand why I enjoy what I do, then I'm not going to talk to you about what I enjoy doing, right? Because you don't seem to understand. So it takes a two-way kind of a process to do that. And amidst all that, really the importance to acknowledge and validate their feelings. So you can validate feelings without kind of agreeing, or without saying that you can still provide guidance, but at the same time also validate feelings, because feelings are actually our own internal experience of things. We cannot tell one person that you should feel this way about that. It doesn't make sense. So we need to attend to feelings first before we go in and provide guidance, or in some cases we may need to reprimand or to punish. But we need to acknowledge feelings first. If you don't do that, then you're not providing the safety that you want. Connection is also by modeling good relationships. You're teaching youth that how can I also build relationships with other people? How do I see common ground? How do I find common ground rather than seeing people as others? How do I see similarities? So that all these are skills actually of building, so that a child, a young person can actually have good ways of developing this sense of belonging and social support, even outside the family. You don't want your kids to consist or always just rely on the parents or the family. You want them to be independent and build social support outside of the family. So moving on, actually, is coping skills. That's another large aspect of it. And this one thing that we see very often actually in patients who present to us with these problems is that over time, they were kind of left to their own devices to figure out how to meet the challenges in life. And very often, people either the more anxious people will tend to indulge in rumination. So they keep thinking their way through the problem, but they're actually just re-experiencing all the difficult emotions. But avoidance as a coping mechanism is a huge problem among a lot of youth. And that's because I think we don't do a very good job of actually providing very more intentional guidance and sense making for them when they're experiencing challenges. So naturally, when we experience something unpleasant or uncomfortable or distressing, we pull away from it. We avoid situations that make us feel lousy or bad. And so we don't learn actually to tolerate distress. We don't learn how to soothe our emotions, to be aware of our emotions, to regulate emotions. And so a lot of my work actually is doing this, guiding them in terms of problem-solving skills, what distress tolerance means, how do you regulate emotions while not kind of shutting them off or suppressing them. And this has a big impact on resilience, because the truth is, life is challenging. We all face problems in life, and in it, you cannot control what life throws at you. So we must build that sense of resilience to meet these challenges and to be able to grow through them. And one thing I think I really always emphasize when I'm talking about this is that youth learn through modeling, not teaching. And if you've ever tried to tell a young person, adolescent or young adult something, you know that chances are they're not going to listen to you, right? So the thing is that a lot of all these skills, problem solving, distress tolerance, emotional regulation, are taught through doing it yourself first. You need to demonstrate it. You need to consistently show it. And and the process of learning of all these things starts really so early. Really right, from as a baby, even as a toddler, you are already needing to employ a lot of emotional regulation skills. By the time you reach adolescent stage, young adult stage, if you haven't modeled it, you won't be able to teach it. You won't be able to tell them you should do this and this. It's not going to sink in that way. And so that's why a lot of that's here in this area of problem solving, distress tolerance, regulation of emotions is where I found mindfulness practice to be extremely, extremely helpful. It really encompasses so many of these skills. Like what Angie mentioned, the mindfulness-based cognitive therapy course essentially really is a 8-week program to zoom into distress tolerance, to understand our sensations, emotions, and thoughts. How do we deal with difficult emotions and thoughts, right? And how do we manage them to soothe them? Is all very well covered in the MBCT course. Providing positive feedback is a big shaper of their own self-esteem and self-confidence. And the reason why is because in a highly competitive society, the way that we operate in society favors strengthening of the internal critical voice. Now, we all know and we all have this internal critical voice. It's that voice which tells you that despite you doing 9 things good during the day, that one thing is the thing that you will bring up and think about at night just before you go to sleep. So that's that critical voice that just harps on things in a very unfair, irrational way. And if we leave kids to their own devices, very often because of the pressures of society, it is the critical voice that gets amplified. It becomes the dominant voice. And so this actually needs to be managed very consciously and intentionally during the developmental years. Like I said, they are vulnerable. This modifies a person's perception of what success and failure means, and it is the guide to build a healthy level of self-acceptance and confidence. So again, to where this idea of non-judgment, curiosity, self-compassion, all these are really fundamental attitudes that need to be gradually built up. Growth mindset is quite an obvious one. Well, I think I didn't change the missed out on the content here. Growth mindset essentially means that where we meet challenges, can we learn to see it as opportunity rather than an obstacle? And life doesn't stop when we meet challenges. We actually suffering or difficulties are great teachers for us. And if we have the skills to manage it, even though it takes us out of our comfort zone, actually that's where learning really happens. The problem is if we don't have the skills, then we get overwhelmed. And that's learning doesn't happen when we're overwhelmed. So this idea of growth mindset is one that's very valuable, very important to inculcate in youth. Healthy habits are often cover exercise, sleep, and diet. So physical activity, slowly we are realizing, has almost equivalent efficacy. That means it's almost as effective as medication in treating mental illness. So I cannot understate the importance of physical activity. Sleep is something that absolutely kids and adolescents need, and unfortunately they don't get enough of very often. Temptation is that they will not do this, and sleep patterns in adolescents can have very long-lasting impact as well. And I mentioned gut health and healthy diet before. And I think this is the last one, meaning and purpose. Meaning and purpose, really often as I see youth in my practice, very often their lives over time, and because of, I think, lack of intention and conscious development, their lives become quite narrow in scope. That means they just home then school, and people who maybe at the more lower end of the socio-economic spectrum is they have to juggle home, school, and work, and then the burdens of life just take over. So it's an important process to encourage youth to actually develop interest and engage with people and communities beyond just school or just their family situation. And that helps them build this wider sense of, okay, how do I make sense of this world that's around me? What is meaningful in my life? Actually, it builds this sense of meaning. It's really sad when I see patients who come to tell me they're so young, and then at the same time, they can tell me and they genuinely believe it to the core that life has no meaning. And that's something I struggle with in the course of practice, because no amount of medication can help you build meaning in your life. There's no treatment I can give that can automatically build meaning, can give you meaning, because our meaning and purpose is built by each of us individually. What gives us joy, what we are interested in, what we are passionate about, what we are good at is what builds our meaning. And so we need to consciously develop these areas in our life. And meaning is also about learning to see meaning and joy even in the smallest tasks or events. So it's not about waiting until end of the week, I can't wait to see my friends. That's what gives my life meaning. But during the week, in the course of the week, all the small things, even the chores that I have to do, can we teach our kids, can we embody first for ourselves that even the chores I do for the home is in service for my family? is doing something meaningful. It's not I must tolerate it and I must get through it. I can't stand it, that kind of attitude. Rather, it's actually something that I'm doing in service for people, and it's meaningful in itself. So a huge part of resilience is this idea: can I learn to see meaning even in the menial or even in the seemingly meaningless things, small things in life? Can I see the positivity and meaning in that? That's one of the big skills towards resilience. So really, I've come more or less to the end of the time, just nice about 1 hour. In summary, we have learned that youth are in a very emotionally and psychologically vulnerable period of transition in their lives. And the truth is they are doing the best they can with challenging circumstances. So really, we need to start by acknowledging, I think, that adults can help, but you can only help you help best by practicing and modeling good habits ourselves. So we don't help by telling them or trying to teach them. Again, I cannot emphasize enough, non-judgment, curiosity, self-compassion are key attitudes foundational to this process of good mental health. And I want to encourage everyone, really don't be afraid to seek help early. And it's always, I always tell people this, and I do counseling in terms of for the younger colleagues, clinicians at work. I always tell them that it's always better to seek help early when you are experiencing some difficulty, but it's not to the extent of causing you problems yet. And then we can have a bit of a leeway to still make adjustments, rather than you're already overwhelmed and not coping well. Then even if I come in and try to support you, there's very little that actually I can do, or you're already have so much you already have so much to catch up on that is even more of a struggle. Seek help early. There are more and more resources that are available. Angie showed put up a bit of information about the screening and assessment process that Brahm Centre does. I will put into the chat the youth assessment service that IMH runs, that's called Chat as well. So I think all these are all drop-in services that youth can very safely approach on their own or through family members, or together with family members, approach, just get an assessment. It doesn't mean you have to commit to care, doesn't mean that you're diagnosed with anything, but really it's just picking up and screening for early signs that there's some challenges. And the reassurance throughout all this, I know we've gone through a lot and some parts were quite heavy, not so good news, but really with good guidance and support, even challenging situations can be managed. And that's something I've really learned through the course of my practice. Even young people who are so tortured and so who are really struggling with their difficulties, I can, with the right guidance, I can assure them that I'm optimistic that they will get better. So that's really the good news. And that's where, just a little bit of awareness, a little bit of upskilling yourself, and a bit of kind of practice on your own with your own emotions and thoughts, it really goes such a long way in terms of helping the people around us. All right, that really brings me to the end of my sharing. So I think we can pop in.
Thank you so much, Dr. Tan, for that very informative and inspiring session that is getting all of us to think about how we can help with our young's mental health. Yeah. And before you take the questions, if I may, I'm just going to also share what we are offering at Brahm Centre to support the youth. So these are programs that are funded by Agency for Integrated Care, with the actual funding coming from Ministry of Health, in order for us all to lend a helping hand to promote and as well as to improve our young's mental health. As they say, it takes a village to raise a child, and it's really true. So we're here to support you as parents. It is not an easy journey, We are more challenged by the options our children have and the wide exposure that they are receiving, which also makes our parenting much more challenging than our parents had with us. So if you think that your children are currently experiencing some low moods, please bring them in. As Dr. Tan said, earlier the better. And for us to help assess how they are doing. And we do provide psychological support as well to both the children as well as the parents. In order for them to, yeah?
Angie, on remaining on this point, would it be okay if you share a little bit more about what happens during the assessment? I think that can help people feel safer or to be more aware, like who do they get to see in terms of the assessment, what happens to the information, is there commitment to see someone after that, if something is picked up, all that. Sometimes some people are hesitant because unfortunately, stigma is still a thing, and a lot of people are hesitant to come to the professionals. But sometimes these assessments are actually done by more community workers. There's no really formal record or things like that, and that can help people feel safe to come forward.
Yeah, thank you for that. So our systems are not connected to the government, so therefore you do have a confidentiality. And when you come for the assessment, it's with our mental health professionals who conducted one-to-one with the child to start off with. And we use the K10, which is the Kaiser 10 assessment tool. After which we will be speaking to the parents as well to discuss a holistic approach to how do we support your child in their journey of improving their mental well-being. And part of it is also to help improve the parents' well-being, because a lot of times if our well-being is not at a great state, it does affect the child. If we come home and we're always complaining about work, and we are also arguing with the spouse, that's really affecting the child's well-being. So this awareness and also tools to help us to calm ourselves down, not to be reactive in the way we respond to jibes or sometimes irritations, it really does provide a more conducive, healthier environment for our children to grow up in. So we do also have an internship program. So your children who may be now waiting for university instead of staying home, just watching YouTube, playing video games, you could certainly write in, just get their CV sent to us, and we're very happy to involve them in a learning journey. And we require them, in fact, to take a mindfulness course as part of the program. So we pay them to learn, and we pay them to experience what life is, that's going to be beyond their education journey. So mindfulness courses, there are many available, and Dr. Tan mentioned as well that mindfulness does help us to be more calm. And when we're more calm, we're also more creative and more engaging in a meaningful way with our family members and friends. So before we get to the questions, I'd just like to highlight to you, if you think that someone is losing their hearing ability, next week is a good opportunity for you to hear Dr. Ho out, and a depression talk on in Chinese, which is not usual that we host Chinese talks, so do take advantage of that. Okay, so I'm now going to stop share and hand it back to Dr. Tan to respond to the questions that you have kindly posted up in the Q&A section. So over to you, Dr. Tan.
Yep, sure. So I'll just go down the list as I'm seeing them as much as possible. Let's see, first one. Are there causes for educators that can undergo, to help students with suicidal tendencies, excluding the usual counselling courses available? Wow, this is a big one. Management of suicide. I'm sure there are available trainings. Unfortunately, I'm not completely aware of what are the options that are available. So this one you probably may need to try to look up for a little bit more, or look up perhaps through AIC. So that's one that you can consider. But unfortunately, I'm not aware of any particular causes that are appropriate for educators. Angie, do you know any?
Yeah, if you'd like to write into us, we'll be happy to help you with a workshop on how to hold the space for our students to be feeling safe, to express their suicidal tendencies, and also for us to be able to know how to hold the space for ourselves, right? Because we might end up being very worried, getting sucked into the fear of our students wanting to even think of committing suicide. But as a school educator, I think you may be obligated to inform the parents, which also could be a backlash on the student who feel that they can't trust any adult and they may feel betrayal. So it's a very delicate balance here that we have to take in terms of how we help the youth. So please write into us at info@brahmcentre.com.
Thanks, Angie. That's great. Is there a link between sleep deprivation and hormonal changes during adolescence? Oh, that's a technical one. I personally am not really a sleep expert. That's one of my other colleagues. So I don't think I can comment too much on sleep deprivation and specifically for the hormonal changes on things. Yeah. If you have other questions about sleep deprivation and patterns, although I think I could try to answer. Yes, Angie has something to add.
Well, perhaps how about the perspective that sleep deprivation does affect the mental well-being? Because I think even for adults, when we're tired, it's hard for us to concentrate, right? And to be excited
Yeah,
about.
so the interesting thing about youth is that actually the tendency is that they choose not to sleep as much out of habit. And that's the patterns that actually youth tend to exhibit. They want to, very commonly we see in like university students, they want to be more productive. They feel the nighttime quiet moments sometimes are more productive. Sometimes it's about social activities because a lot of it happens in the wee hours. Sometimes they look like they're playing computer games. Actually, it's because everyone else is kind of on at the same time. So it's a lot of these tendencies that kind of shape their expectations. And unfortunately, it doesn't help that sometimes when they leave the formal school system, they go into tertiary education, the hours become a lot more flexible. Even in, I think, polytechnic, the hours are no longer like, the kind of 7:30 to afternoon. The days start later. And so the tendency is to push the sleeping hours backwards as well. So a lot of them are getting enough sleep, but they are not sleeping at, early enough and they're waking up late. And what we see often, the impact of that more directly is on future sleep patterns. When in the future, they, let's say, start work, for example, they graduate, they start work, and then they come and tell us, oh, I can't sleep now because I was keeping these hours, 4 a.m. to 11 a.m. in the morning when I was in school. And then now I have to get up so early, I can't recalibrate. So the impact that I'm seeing more practically speaking is actually this kind of delayed sleep hours pattern. As to whether it affects, yes, it does, because if later on you start developing emotional symptoms, then if you're already struggling with your sleep, that's going to just compound the difficulties that you're experiencing. And a lot of people also find that if I'm having emotional problems, a lot of youth report that their emotional problems are worse, their symptoms are worse at night. And that's why, and why is that? Because at night is when we are quiet, there's no distractions. We end up having to be alone with ourselves. Even if we can distract ourselves with the computer, with the devices, with entertainment, when you lie down in bed and you try to sleep, you are completely alone with yourself and your thoughts. No way to escape that. So the ability to sleep sometimes lies at the intersection of that. And so healthy sleep habits actually start early. The importance of actually keeping regular and consistent hours, that really needs to start early. So that's the impact. Yeah. Yeah, I think I like the next question. That leads nicely to the next question. Is there a time period during the day that the moods of the youth are more affected adversely? This is exactly what I said. Very extremely common pattern I see in youth. Nighttime is always nighttime. And it's interesting because there will be youth that can tell you that, you know, I really don't like the night times because that's when I have to be alone, you know, and and if you ask them what their days are like, they're just filled to the brim with things, and some of them juggle multiple jobs. They are working while they are studying, you know, and extracurricular activities, or they spend time with their friends. Actually, all these are avoidance strategies. A lot of avoidance is they don't dare to be alone with themselves because the mood creeps in when the thoughts come. And that goes back to what I stressed earlier is distress tolerance, is learning to emotionally regulate. How do we be friends with our emotions, even the difficult ones? That's such a valuable skill to eventually learn. That you know, so nighttime is really the difficult one, and that's when, you know, yeah, I always, and whenever I see that pattern, I'm always kind of encouraging them, consider trying a bit of mindfulness. But for youth who are already struggling significantly with their moods, it may not be helpful for them to try mindfulness on their own. And that's because if they are not having a proper course or guidance, sometimes leaning into the difficult emotions on their own is very difficult, or it can make things feel worse. And that's where the value of having a course, you know, a full 8-week course, or even pairing a course with one-to-one, I think, counseling, especially with a counselor who may be familiar with mindfulness, extremely helpful, because that really reinforces the skills that you're learning really from basics, and then building on towards being with difficulty. So the MBCT course really does that very intentionally.
If I may just add, since morning is mentioned,
yeah.
Morning tends to be a very moody time for young people, because a lot of them sleep late, so they don't like waking up in the morning. And if they're not excited about what's going to be in the day, then they tend to be very irritable. So don't take it personally. And especially, I'm also a parent. I used to just give them space, not expecting them to be even grateful that I'm driving them to school or to camp, right? And just knowing that that's just how teenagers are, yeah. And let that pass.
Okay, next question. Is Tourette syndrome a mental disorder? What's the underlying cause, issue, and how does a person overcome this condition? Okay, unfortunately, Tourette's lies a little bit more within neurology rather than psychiatry. There are some psychiatrists who kind of do cross the disciplines of neurology and psychiatry, the psychiatrists, who may be familiar with Tourette syndrome. So Tourette syndrome is what is known as a tic disorder. So it's about difficulty controlling the impulse to verbalize things or to have kind of tics. And so it's usually lies more in neurology than psychiatry. So I don't think I'm the best person to be answering exactly about causes and possible treatment. All right, thanks for the informative talk. You're very welcome. Bringing in suicide, yes. May I ask if decriminalization of suicide in 2020 has changed in many ways the cultural fabric here? How has the reform bill impacted the work that you do? Wow, I like this question. Yes, really great question. And it really shows that you are keeping abreast very much with, I think, the developments and changes in our laws. But the answer is a little bit complex, and I will explain why. It's because actually, as much as I am personally all in favor of decriminalization, essentially we do feel that people need help rather than feel the weight of the law. That said, you know, in Singapore as a society that is very rule abiding and very authority means a lot to many people in Singapore still. Having a law there was and sometimes a protective factor. Some people say that, you know, because it's illegal, I'm not going to do it. So it was a bit of a protective factor in some cases, which essentially now we've kind of lost. That's number one. Number two is that the legality of it made reporting it a lot more robust. So anytime a suicide attempt was made and the hospital knows about it, because it was the law, they were legally bound to make a police report. So that made suicide attempts something of, the reporting and data gathering was a lot better. And so we could keep track of the numbers. Without the law, now it relies on voluntary reporting by clinicians if they remember. It's not that we don't want to report, but and MOH wants to collect anonymously the data. So I don't need to know who you are, but I would like to know if you've seen an attempted suicide case in your care. And I just want to check the numbers. But, as with these things, the busyness of clinical care is very often the last thing on our minds. So I would say the change is in many ways in these two areas. But that said, I think all in considered, decriminalization was really probably the right way to go. I don't think, anyway, just to let you all know, it was something that was almost never enforced. It was never, the law was there, but it was never used. It will only be probably used if someone was really doing it egregiously and causing a nuisance and consuming public resources and things like that. That would be the only plausible situation that it would be used. But the fact of that I have if I was troubled enough to harm myself and then I end up with a police report and an investigation, that's just unpleasant. So on the balance of things, I think it was the right move. And then on the other hand, in terms of provision of support and care, that's the part that we need to work more on and improve support. So I think that's what we are focusing on.
Yes, it makes our work as well in the community easier because people are able to be honest without worrying that we're going to report to the police and then the police going to show up at the doorstep. In the past, it was actually a requirement for us to report. And then people don't want to reveal to us, right? So right now, I think there's a lot more confidence for them to be able to be open about it, and therefore we can actually help them without them being fearful yet of another thing in their life.
Yeah. All right. Is there a genetic relationship in the patterns in hormonal changes? Well, the nature of hormonal changes in adolescence really is biological, and so I presume there would be some degree of a genetic relationship. Perhaps if whoever asked this question, if you have something a bit more specific, and then I could see whether I know enough to answer to that. But as it is a bit generic. So yeah, there probably would be some familial or hereditary patterns to hormonal changes. I mean, we all go through this period differently, right? So that might be. Okay, next question. My daughter told me that her friends in school do not wish to go to school counselors as they feel that there is no privacy or confidentiality. As their form teachers or civic tutors will be informed of their issues, they will be called out by their teachers and sometimes even their parents will be called. Are there counselors outside that these youth can go to on their own without parents' accompaniment and at nominal fee? My daughter will lend them her listening ears, but she doesn't know how to help these friends. So absolutely, I really appreciate this question because I think it reflects a huge reality on the ground. And I mean, to give MOE and the schools and the councils credit is they are operating within the limits and the rules that they need to abide by. So generally, I'll tell you this, in terms of how confidentiality usually as helping professions work, is that we will upfront inform clients or patients about the limits of confidentiality. And the limits of confidentiality usually are drawn at the point of if you are posing a risk to yourself or to other people. And that's what we would maintain as the limit of confidentiality. Now, I'm not involved in training for MOE's school counselors, so I can't comment on what they set as their rules of how they operate as school counselors. A lot of it may come down to their own individual kind of professionalism or their way that they practice. And unfortunately, we are well aware, as has come to light in the media before, that there is variation in how counselors, especially the school counselors, practice. So unfortunately, I think a lot of students have experienced these kind of situations where, you know, their confidentiality may not have been observed or protected to optimal or more ideal extent, and therefore it has kind of affected the level of trust in services. So yes, the answer as to whether there are services, the answer is a clear yes. Clearly, Brahm Centre's counselors would, you know, be very safe avenues to seek help. I can quite guarantee that even all the family service centers, so actually the most accessible counseling that anyone can actually access lies with the social workers at family service centers. And we have family service centers all over the island. And you know, people can drop in and kind of let the social workers know, or the center know, that I would like to seek counseling. And again, these professional boundaries of confidentiality apply, because these people are trained across the board as to what counseling is supposed to be. And therefore, you know, the clients can trust that, you know, all this will be quite explained to them upfront, and they know what they should or should not reveal possibly to the counselor. That's a personal choice, but at least they can get help. They have someone that can support them without, you know, risk telling other people about it. So Brahm Centre Family Service Centre, the chat service, I posted a link in the chat room. The chat service is a youth-oriented assessment and support service run by IMH. And they don't really do formal diagnosis. So they do assessments, they do intake assessments, they take a history, they come up with an idea of, okay, I think you have this condition. We can make a referral for you to appropriate services. So youth can use that service to get an initial assessment and screening, and then be linked up with appropriate services that are safe for them. Okay, so do lean on that. Check in with Brahm Centre, as Angie has shared some of the information in the chat as well. So there are definitely very safe and very robust services available. Do psychiatrists at IMH provide counseling too? So to explain a little bit more, actually the mental health sector is kind of divided up a little bit into psychiatrists, psychologists, and counselors. So these are the different kind of professionals involved in providing care. Psychiatrists actually are doctors. So our primary job is actually diagnosis and treatment, usually more treatment with medication. So because we are the only ones who can do that. And so a lot of our appointments, right, are short in duration. So the appointment length ranges between 10 to 20 minutes for a review visit. That usually is not the right length of time for counseling or for therapy. It's usually a quick check-in. I will assess how you are doing. I will do a review of your medications. Some psychiatrists are fairly psychologically inclined. That means we enjoy doing a little bit of counseling, or we enjoy doing a little bit of, you know, brief therapy work. We may attend training in other fields, cognitive behavioral therapy or mindfulness, like for myself. Then I will, to the best of my ability, when I'm able to squeeze out a little bit of time to do a bit of the counseling or even brief therapy in the course of our work. But generally, we don't do full counseling. It's extremely not cost effective for a doctor or a psychiatrist to do an hour long of counseling, because when we tried asking and setting up a service, I think finance from the hospital told us that you have to charge patients like something like $250 for a session to do therapy. So it just wasn't acceptable for subsidized care. So generally, my answer is doctors and psychiatrists don't provide counseling. We squeeze it in if we are inclined to do so, or we feel we are able to, but that's not the main aim of our service usually. what books or resources we can read up to understand and improve ourselves to support our youth at home. And really, I think Brahm Centre will have lots of
I have
info
put a
in
list
course.
in the chat.
Yeah,
Yeah.
yeah. So without a doubt, look it up. One app that I like is I don't know if Angie has mentioned, but it's also Healthy Minds Program. You can look up the Healthy Minds Program app. That's one app that I quite like. It's created by Professor Richard Davidson, I think. I always get his name mixed up. Yeah, Richard Davidson. That covers well-being very well. So a lot of what I talked about today, the different levels, connection, awareness, insight, and purpose, these 4 pillars I often talk about in talks, are covered by this program, and it's guided through lessons for people to experience. So try that out. Lots of books and apps, but at some point, my encouragement, actually do experience in-person course for yourself, especially because I think what you can get out of really practicing and experiencing it, and then sharing and asking questions, having someone to guide you, that level of input is invaluable and will make so much of a difference in terms of your own ability to, I think, practice and embody a lot of all these things. Will psychiatrists then offer to send patients to counselors then, or will patients be entirely dependent on medication alone? Psychiatrists will refer on, so definitely. Psychiatrists, in the course of planning treatment, psychiatrists do not rely on medications alone. It is our job to kind of discern what other support services or modes of therapy are appropriate for patients. So definitely, medications may be a big one that we do talk about and provide and kind of offer to patients. It's not a guarantee that you must be given or you will be given medications by the doctor. Okay, the doctor needs to assess the condition and the appropriateness of medications, and also take into account the patient's preferences and willingness to actually take medications. It's a big issue that we deal with very commonly. So don't feel that you need to agree to medications immediately once you see a doctor. I take the approach that, generally I take the approach that it's very practical. I can prescribe you the medications, but in the end, when you go home, bring it home, you're the one who has to pop it into the mouth and swallow it on your own. So if you are not willing to do that, I'm not going to push it on you, because in the end, you make the choice to take it, right? So it's really part of my responsibility to work together with you to arrive at a treatment plan that is acceptable to you. And to be honest, it varies. Not everyone is resistant to medication, and also not everyone wants to have therapy. That's a big one, because a lot of people actually don't want to talk about their problems and their emotions, and they don't want to do the work of actually practicing things like the skills and regulation and things like that. So you'll be surprised. A lot of people say, just give me something to to take in the morning, or to take on a daily basis. I need help with my symptoms. So yeah, it really, we will refer on. We have therapists in the hospital. We will refer to services like Brahm Centre, family service centers to do the counseling if it's necessary. How do parents help young adults to open up about any trauma, example, bullying, rejection, failure in studies? Yes. Again, as I mentioned, it starts with safety, trust, and connection, the necessary ingredients for your relationship with them. You just ask yourself, are you going to talk about your problems with someone who doesn't make you feel safe, who you don't trust, and who doesn't seem to connect with you? The clear answer is that you probably wouldn't. So in essence, if you have the right relationship, then all you can hope for actually is to provide that safe space for them to come to. You cannot force them to share what they're unwilling to share, even though you are really concerned and you may see that it's a big problem. But in essence, everyone has the right to kind of choose, who they seek help from, I think. And there's no way that we can force people to open up to us. We can only provide that open door to them. And so our responsibility is to really keep that door open, keep the space safe. And then we allow them to just come to us, be it whichever area or aspect of their life they're struggling with. We just want to be able to walk with them. One of my friends very wisely told me that the entire principle of raising a child is I hope that I can be someone that my child will always feel safe to come and talk to. Very, very simple. And when you have that clarity, and in a previous talk I gave about youth and young people, when you have clarity of purpose and clarity of aim, then when we can remember and make that our intention, that my intention in my relationship with my child is to always maintain that safe space, then everything we do and all our actions around this person that we want to help need to align with what our aim is, so that we are conscious of actually in every moment what we are doing, how we are responding to them. Very often we are so unconscious of what we are doing that I know I want to build good relationship, but most of the time I may be dismissive, or most of the time sometimes I lax into being not present or things like that. So that is the risk usually in terms of where we need to do the practice first ourselves.
And if I may add, as parents, we really need to give a safe space for our children to express these fears that they have, and not to be dismissive, as Dr. Tan said, by saying, yeah, no need to worry lah. Why are you so concerned? This is not really helpful in this kind of replies. Instead is to explore it with them without judging them. And if it's bullying, sometimes what parents do is immediately go to the school and complain about the other child. And that may not also be very helpful, because we need to teach our children how to change the response. You will start to notice that bullies tend to pick on people whom they know they can actually get away with it, or the person is very teasable. So when we teach our child to change their response, actually helps them throughout their life, right? Now, not to be the one to be picked on. So perhaps come to us. We can explore this with you as well as your child. Yeah, it doesn't need psychiatric support.
So when I was doing research for talking about relationships with children between parents, I thought I came across some good points made by Brené Brown. I think she's quite well established in looking into emotions, and also how we as people and as family members or parents respond to emotions. A lot of the dismissive kind of words that we use are because difficult emotions cause us to feel we experience difficult emotions as unpleasant ourselves. Right. And so the natural response is we want to stop it. We want to put a stop to it. We want to avoid it. We want it to go away. And so what comes out is very reactive. It's very spur of the moment, rather than a conscious decision. I'm going to lean in. I'm going to embrace actually what you are sharing with me. And I'm providing a safe space to hold that difficult emotion that you are sharing with me now. So that is actually a skill. That's a real skill that takes practice. Because it takes your own emotional regulation. You need to be stable in terms of your emotional regulation to be able to provide that emotional holding
Yes.
for family members.
So that we don't jump in and try to rescue our child, because that's not really helpful. We need to be able to empower them, to help themselves and feel more confident of themselves.
I think the empowerment even comes as a second step, even because really that's where I mentioned in my slides, acknowledge and validate. It's actually really this process of many times we all know that when we go to someone to talk about our problems, we don't want a solution. That's not the first thing that we are there for. We are really there for someone to connect with us and to empathize with us, to share that you know that I'm suffering. You understand that I'm suffering and I just need you to be with me. So that is actually the safe space. It's not the safe space that it's just not blank listening. It's not providing advice, it's not that. It's just being with. So that's I think that is actually the strongest representation that you can manifest to let them know that you care. It's really that level of care that you are demonstrating towards the young person.
Thank
Next
you.
question: what are the current efforts
Guilty
of?
to overrun in time. It's already.
I'm okay. I know Brahm Centre audience always very interactive, which is a great thing, because
Okay.
sometimes we give talks and it's just silence, and then we don't know how well it's received. But no, I'm happy to give a little bit more time to answer these questions. So yeah.
Thank you.
What are the current efforts made for LGBT youth in general? On this respect, right? How should I phrase this answer? So I didn't specifically mention. It did come across my mind, but I think with improving, at least awareness is improving about the needs of this community, and the specifics of what youth who are struggling with sexuality or gender concerns are. The community has created resources on its own, counseling services that are safe, that are knowledgeable about the issues that LGBTQ youth face. So you can approach Uga Chaga. If maybe Angie can share in the chat. That's Uga Chaga is the specialized counseling service for LGBTQ youth. The transgender community has also their own services. I think the support is from Transgender SG or something like that. Yeah. So do look it up. The community has specific resources. By and large, my reassurance is also across the public healthcare sector. Generally speaking, the safety is there. Unfortunately, it may be a little bit practitioner specific. So I mean, as with any service, sometimes the individual you can't separate the individual from the practice. Unfortunately, psychiatry, psychology is one area that is so personal, right? Touches on the emotional, so deep that you cannot separate completely the therapist from the treatment. But by and large, in fact, I would say almost all the younger group of psychiatrists are all very affirming. So don't hesitate to seek services, and also discuss difficulties with the therapist or the psychiatrist if you encounter any. I hope that answers the questions. If you have anything else more specific as to LGBTQ issues, please feel free to bring that up. Angie, if you could just leave the question there just a little bit longer so I can reference back as I'm answering, that may be helpful. If it disappears too fast, then I may miss something. In your practice, is there a trend where patients seek help in the clinic but discontinue after a few sessions due to time or cost constraints? Oh, absolutely. That's a very common one. Because we recognize, I think, especially in public healthcare, we recognize the limitations, cost, time, pressures, right? School, work, all these are very real limitations. So in public healthcare, we do commonly see a lot of youth especially are vulnerable, because a lot of times they may not have the financial ability to maybe fund their own treatment. Also, confidentiality is an issue, because we tend to send like mailers and things like that to the home, and then parents sometimes see or things like that, then they don't have privacy to take medications. All these things are real concerns, especially when the family system is not very knowledgeable or supportive of mental health care in that respect. So there are very real life pressures that do cause people to discontinue care. We do our best, but we are limited as well. Unfortunately, we don't have evening clinics, we don't have weekend clinics. These are things that the hospital doesn't really cater for, but we'll point you in the right direction, and we are equipped to work with you around the constraints that you are facing. So my suggestion, be frank about what are your challenges with whoever you are seeking help with, rather than drop off. What we see very often is people drop off and then we don't know why, like what were the difficulties, right? If you have a frank conversation with me about your difficulties, don't be shy. I mean, we are here to deal with these things, whether it's cost, whether it's family, all these things, they're nothing new to us completely. We don't judge. There's no value judgment in terms of all these things. It's really, we rather have that frank conversation, then we can advise you, okay, maybe this one won't work for you, let's look at something else. So really be open about these challenges. How about minority youth mental health? What kind of care is provided? I'm not really sure what you mean by minority. It could be ethnicity, it could be gender or LGBTQ issues. Again, one thing I hesitate, and I will caution against segmenting the population too finely and differentiating out different populations by minority in certain way. In fact, even in terms of LGBTQ youth or LGBTQ clients or patients, a lot of the issues they face are your everyday issues. They are people just like everyone else and face the same, kind of anxiety or depression, and the needs are not exactly that special. Of course, different segments of populations may have specialized needs, and that's where we need to be a bit more sensitive. We need to be knowledgeable about what is different, what is special to the different communities. But other than that, actually the care that they need is actually very similar. And so if you can share a little bit more, what are the specifics of the minority that you have in mind, then maybe maybe we can explore a little bit more. Can you talk a little bit about addictions, be it gaming, substance, or others? What makes a person addicted and not another? Where does that sit on the mental well-being spectrum, and how do we explain addictions? So full disclosure, I'm not really an addiction specialist. It is a sub-specialized area of psychiatry. And also in Ng Teng Fong, we generally don't have so robust of a service for addictions, because addictions is a chronic condition. So it's not something we can treat just by medications alone. It requires a whole team of support, for example, from counselor to therapist to doctor to social worker, because addictions is complex in its nature. It lies at the interface of biology. There's biological factors, there's psychological factors, and very often very strong social factors as well. So we need to address these things in totality, holistically. Yeah, so very often if you look at, we will approach the patients with addiction issues in the same way with this biopsychosocial model of assessment, and then tackle the issues separately. Sometimes medications are used, sometimes to help with mood or emotional difficulties, but otherwise actually a lot of it lies with counseling, working with family members and things like that. Yeah. So I hope that answers the question. Thank you very much for this extremely informative session. You're very welcome.
Best morning routine.
Sorry. Yeah, I'll just go on with the question. If anyone wants to jump in verbally, that's fine as well. We'll give you a bit of time later.
I'm going to post Dr. Judson Brewer's YouTube on addiction. He's one of the specialists, psychiatrists from Brown University.
Addictions can be a whole new lecture. So maybe MG, you want to do request for someone to do one of that. Yeah.
Okay.
If you know anyone from IMPH, I think the interest may be there.
Yes, it's growing.
Yeah. Yeah, my kids are 25 and 27. Yeah, I found some of these pointers very useful. Yes, they are definitely applicable across the board, to understand why they act the way they act occasionally and how I can understand them better. It appears mental health education which is non-existent in my younger days, absolutely, is so very important for parents, irrespective of their age, and it's a lifelong education. So thank you. Yeah, so this is more of a comment than a question. Yeah, completely agree and appreciate your comment. You're very welcome, and yeah, it's really applicable across the spectrum. I think today we talked about where youth are a bit more unique, the special needs of youth, the characteristics. But actually, a lot of what I covered is the same advice I give to my adult patients, regardless of age. It's just that the trend, unfortunately, is that youth are starting to present with more and more of these emotional challenges. In the adult population, I think they are a bit less, in the older generations, there's less of an existential struggle. They may have kind of overcome that already, or they kind of settle in, I think, into the cadence and the routine of life. And what presents later is usually when real problems appear, or is really a kind of a biologically driven anxiety condition. Sometimes that is what we see in adults. The skills are the same, actually. Emotional management, coping skills, regulation skills are the same. But the challenge with adults is it's much harder to get adults, especially the older adults, to learn all these new skills. So adults tend to lean a lot more on medications. That's a trend that I see, especially the elderly find it especially challenging. So we don't often send elderly for therapy, to be honest. But kids, the good thing with young people is that they respond much better. The capacity to respond to psychological intervention is much better. And if they are motivated and receptive to psychological intervention, like therapy, counseling, mindfulness, the results are so much better. And the aim, I will assure you that actually a lot of our aim is to get them off the medications as soon as possible. So the principles of medication use, as little medication as possible, come off it as quickly as possible, but safely at the same time. So if they can get the psychological care, actually that really helps with that process.
Okay, to the last question.
Yes. Youth usually have conflicts. Oh, another one.
We're gonna have to close.
Yeah, sure. I think it's a clarification. Yeah, ethnic and sexual minorities, for instance. How are mental health professionals trained to be sensitive to diverse backgrounds? The truth is, and I'll be honest, we are not specifically trained, but at the same time, a lot of the younger trainees and younger psychiatrists are very well aware and are quite well connected with what is going on. We are, for better or worse, we are a product of our generation as well. So we are aware of this. In fact, a lot of services, for example, the gender clinic services were started by some of the younger trainees, younger specialists and psychiatrists. So there really is that level of awareness and acceptance, which really has kind of really broadened what is available to people. And yeah, so definitely I think I can assure you of the safety of seeking help if you really need to in the system. Youth usually have conflicts with parents over boy-girl friends relationships. Besides telling them on consequences, their immature minds don't bother. How to help both, especially with parents, with BP arising. I assume there's blood pressure going up. Okay, where do I start in talking about this? Again, I think it comes back to the principle that if you didn't, or if it didn't come across in terms of your modeling what healthy relationships look like, if they reach the stage of adolescence or young adulthood and you are trying to tell them, that's probably not really going to work. And unfortunately, that's one thing that for the young people that I treat, and when I see their parents, and the parents often are quite distressed over what their child is going through, understandably, there is a process where I have to work with the parents on really coming to acceptance that this is where things are. That whatever the case is, what may have been ideally done in the past wasn't done already, and we can't change that. And so we have to start where we are and look at what are the conditions present now. How do we improve that to help the young person, to help the parent and the young person? So it's really it starts with acceptance. A lot of parents start with, I don't want this situation to be like that. I don't want my child like that, right? And then there's a lot of guilt, blame, accusations, whatever, you know, on themselves, on other people, on the child. All these actually worsen and complicate the picture. Rather start with a picture of acceptance. Okay, my child has certain characteristics, right? They may not be wise enough to discern the right thing to do in certain relationship issues. Can I, rather than go in and try to do intervention, give them advice, tell them what to do, can I try to really deeply understand my child? Firstly, what is driving this person? Why do they feel so strongly attached to the relationship, for example? What are the factors that give them joy versus what are the factors that cause them suffering? Really understanding, only by truly deeply understanding and helping them start to see that you understand, that you acknowledge that this relationship means a lot to them, right? And for certain reasons, but at the same time, it's also causing you problems in many aspects as well. In some sense, it's the same process that a patient encounters when they meet a professional, because we have the advantage of being in a consult room and being doctor-patient, that you would divulge everything that you are experiencing to me straight away. But I also have to engage in the process of deep listening and of genuine understanding and of holding space to reassure you that it's okay to tell me, that I'm not judging you. Essentially, it's the same thing. You have to be that constantly for your child and for all our loved ones, right? That we can take a non-judgmental, curious, and compassionate view of their situation. Only then can you help yourself, and only then can you help other people. So if you're curious, and that ends us on a very nice note, but if you want help to develop some of these abilities, please try out some of what Brahm Centre is offering, really. Considering looking up their YouTube videos, I think they've recorded lots of it. And then actually all these things that we are talking about is covered in the course of mindfulness practice. So try out the foundation course or go for a full MBCT. I think that would be really helpful. And what's helpful and what people have told me is that when the child or when a family member goes for MBC for a course, and then the parent goes for a course, there is also a common language. There is common alignment of the attitudes, that we can both approach each other and these issues with that same non-judgment, same curiosity, and the same compassion for ourselves and for the other person. So again, it's that alignment. It can help you do a little bit of that, but then the work after that comes, you know, in really understanding, listening, and etc. So yeah, I think that brings us to nice close of today's session.
Well, as a parent, and I've been also teaching parents, there's a difference between parenting with confidence and parenting out of fear. And when we parent out of fear, and that's why we try to stop our children from having relationships with the opposite sex, or in the case of if our children are gay and they have a relationship with somebody of the same sex. When we try to stop that, it's probably going to drive them further away from us, because that's just going to cause that rift, and we would lose our influence. So really, many of these relationships at this age, they're very transient, and it's to support them so that they can also learn to explore their own sexuality. And I don't mean having sex, but their own sexuality as to what kind of people they could be interested in. They also learn how to do social networking, because I have clients who come and the person is 30 years old, never had a date, and now finding it very desperate. And this is actually going to create not necessarily a very healthy environment for this person to connect up, because when someone's in desperation, the choices they make may not be the best for their life. So be open to our children having relationships. So thank you very much, Dr. Tan, for that. And somebody did ask that I put this up again. So the internship program, you can take a picture of this or just go to our website for an image that is available there too. And those of you who are considering mindfulness, there is one on parent and child mindfulness, in fact. So for both parent and child to learn it together would actually be more ideal. Thank you again, Dr. Tan, for your wonderful session and giving the extra time. And thank you all of you for staying back. And I hope that this is really useful and will help you in your journey of parenting as well as your own mental well-being journey. Bye-bye and take care. See you next week.
Thank you, everyone. Take care.